Can you tell us a little bit about what's the difference between a lumineer and a veneer, Dr. Vuong? You know, to me, they're both clip-on fingernails or tooth nails, but there must be some difference because, you know, why are there different things?
Well, Lumineers, they are veneers, but they are a brand name veneer. Yeah, so it's kind of like just a brand name car. The Toyota is a car, but the brand name is the Toyota. A Lumineer is kind of like a high-end one. It's thinner. It's more aesthetically pleasing.
Okay, got it. I see. So it's the lumineer is thinner and thus is more aesthetically pleasing. Is that what you're saying?
Yeah, and also it's more conservative because you don't have to cut down the teeth quite as much in order to, I guess, install these Lumineers. I
see. So on a normal, yes, because if you take a normal veneer, you know, which is that fingernail going on, so basically you grind down the tooth to make sure that because otherwise if you lay the veneer over the tooth, that sucker becomes huge, right? And you say on a lumineer you don't need to do that or not as much?
Depends on the tooth. A lot of times you don't need to do anything at all. You can just get them custom made as is. Sometimes you do need to make a small adjustment to some of the teeth that may be misaligned. They may be sticking out a little too far. You do still need to make a little bit of an adjustment to make them look nice.
But less. And in terms of looks, you know, would you know if I have one lumineer and one veneer, which one is which one? Would you see that?
Yes, to the trained eye, you can tell which one the Lumineers are. And I guess even to the general public, Lumineers look really sharp. They're very natural looking. They're very, very, very nice. They look very natural and beautiful.
I see. So actually the Lumineer, which is the name brand, which is thinner, which perhaps can be put on without grinding down a tooth, which must be a good thing, right?
Yeah, definitely. You don't want to have to grind down a healthy tooth if you don't have to.
Right. You explained that in terms of why a person might possibly be lots better off with a implant than with a bridge, where you have to room two perfectly teeth next to each other, you know, which couldn't be so good. So okay, so basically, in that case, Lumineers is slightly better. In terms of price, Lumineers, veneers, a huge difference?
No, actually not. You know, the difference between a Lumineer and just a regular generic veneer, maybe $30 to $50 difference.
Wow, okay, so that's really not, we're not talking, you know, major here. And so for cosmetic dentistry, for, you know, getting that gorgeous smile where maybe the teeth become longer or shorter or wider, and definitely a different color, you know, maybe even they're a little, you know, tweaked and crooked to straighten it all out. Veneers or Lumineers both do the same work, and for all purpose, for us patients, we don't really need to worry about which one the dentist will let us know what we should have, and it's one and the same, more or less, for us.
You're right. I don't want patients to get the wrong impression that just generic veneers aren't nice. All veneers are very aesthetically pleasing. They are a cosmetic procedure made to enhance how our teeth look. Lumineers is simply just a brand name. They just happen to be more of a high-end product, which look a little bit slightly better than the average veneer. But, you know, keep in mind, all veneers look very sharp.
And sometimes you need to grind the tooth down and stuff like that anyway. Is there one time or another where one just doesn't do the trick and another one does? Is there such a situation? Or not really?
I think so. I think, let's say a patient comes in with heavy tetracycline stain on their teeth. This is like a yellowish, brownish stain on all their front teeth. And with those, you can't have a veneer that's too thin, or else the stain will show through.
Got it.
So, in essence, you might not have much of an advantage in using those thin Lumineers.
Got it. Got it. And can both the veneer or the Lumineer have the shade the patient wants?
Yes, both, veneers and Lumineers, they have many, many, many different shades, and we can definitely match it to the patient's natural tooth shade, or we can go Hollywood white.
$1 million smile.
That's
Julia
right.
Roberts and Brad Pitt, Tom Cruise, $1 million smile, huh? Tell me, to those people, I mean, you saw them on the movie. I don't know whether that's close enough for you to notice or to see or do whatever. Do those three people I mentioned, and I'm not in any shape and form obsessed with any of those three. In fact, that's the only few names I can mention. I'm just simply not, I like movies. I just don't care who plays in it. I just go there for entertainment. But do those three people have their natural teeth or not? What do you think? I mean, and it's okay to say I don't know, but I think this is how it is. What do you think?
I think Julia Roberts is natural, because her teeth she's had the $1 million smile since Pretty Women, and I believe at that time she was just a rising star, 19 years of age. I would doubt that she got all veneers at that time, so I would think hers is natural.
Okay.
Tom Cruise.
She does strike me as that girl who, I mean, at least from a movie, right? I mean, that Pretty Woman movie was pretty amazing, wasn't it?
Yeah.
Tom Cruise.
Tom Cruise definitely had a big midline problem. I think his midline was like over here on one side, and now it's been corrected, I think, with braces and Lumineers or veneers.
Braces?
And
when does a guy like him has had time to wear braces between movies?
And who's the third person?
I don't know whom I said. Brad Pitt.
Oh, Brad Pitt? Brad Pitt, I would bet he has some sort of veneer.
All right.
Yeah.
All right. I have no responsibility if any one of those three is going to come and sue you tomorrow, okay? All right. Dr. Vuong, it was real nice talking to you. Bye-bye.
Thank you.